Hello, welcome to Health Talk with Dr. Toyin. Today we'll be discussing uterine fibroids. Uterine fibroids are also known as leiomyomas. These are growths of the soft tissue of the womb, and they are likely to be harmless. There are three main locations where the fibroid can be found in the womb, and these locations include submucosal, intramural, and subserosal. I'll show you a diagram so you can better understand. The risk factors for the development of uterine fibroids include being of the Black or Asian race, as it is more common in them than Caucasian women. It is rare before the menarche, which is the first period, and also after menopause. If a woman has a fibroid, it is likely to shrink after menopause because of the reduction of the hormones, but it can still get bigger if the woman takes estrogen supplements. It is more common in those that have not had children or leave a wide gap between children. As my lecturer in university described it, fibroids are like weeds on a football field. If you don't play on the field, weeds will develop. It is also common in those with a first-degree relative with fibroids. How do you know if you have fibroids? Many women do not even know they have fibroids, and incidentally, it is found on an ultrasound scan. If fibroids cause problem, they might cause excessive bleeding or pain during menstruation. Because the fibroid size can range from a few millimeters to 30 centimeters, and they can be either singular or multiple, the fibroid or fibroids might press on surrounding objects. If it presses on the bowel, it can cause either constipation or diarrhea. If it presses on the bladder, it can cause increased urination or incontinence. There are some tests that can be done if you suspect fibroids. The full blood count, which is the blood level of the woman, can be determined. If she bleeds a lot, she might be anemic, which means she has a low blood count. An ultrasound scan can be done to determine the location and quantity of fibroids. If a more detailed examination is needed, an MRI scan can be done. What are the treatment options for fibroids? It includes things like expectant management, and this occurs in those that are near the menopause, whereby they just observe the woman, because most likely after menopause, the fibroid will shrink. If medical treatment is needed, things like non-steroidal anti-inflammatory drugs, tranexamic acid or mefenamic acid can be used. This helps to reduce blood flow and pain during menstruation. Some hormones can be used, which can be used to shrink the fibroid temporarily, especially if surgery is planned for the future. Don't forget, estrogen containing medication can lead to an increase in the size of fibroid, and note it is just for pre-existing fibroids. Depending on the size and location, a myomectomy, which means removal of the fibroid or fibroids, can be done. A uterine artery embolization can be done whereby the major artery supplying the womb is injected with a substance which cuts off the blood supply to the womb and the fibroids. In this way, it can shrink the fibroids and cause less blood loss during menstruation. These treatments are dependent on if the woman wants to preserve her fertility or not. Depending on size and symptoms too, a hysterectomy can be done, which means removal of the whole womb. This is a very common condition, especially among the black race. I know personally because I have had 2 surgeries concerning this. I hope you enjoyed this video. Don't forget to watch again and share with your female relatives and your male relatives so they understand what is happening. Don't forget to subscribe to my channel so you can get updates on new videos. And until next time, smile because it's healthy. Bye!